Okay, thank you so much for joining us. I want to begin by introducing all of our guests, and then each of them will speak, and I'll call on them to speak. But I want just to let folks know that we've got Chris Aylward, president of PSAC, on the line as well. We've got Candace Rennick, who is our secretary treasurer for CUPE Ontario, and Christine Collins, who's going to share her personal experience with regards to a loved one in long-term care. So I want to begin off the top by highlighting the report that has been put out recently for an organization that looks at corporate tax responsibility. And it is absolutely clear that Revera is engaged in aggressive tax avoidance practices. And what makes this so offensive, what makes it an insult to injury, is the fact that Revera is the second largest for-profit long-term care operator in Canada, that it is the site of some of the worst conditions for seniors when we're talking about infections, the lack of quality care, and deaths due to COVID-19. This organization is also taking public money, but it is engaged in some aggressive tax avoidance, so they're not paying their fair share back. It's for profit. They are exploiting families, exploiting seniors because of the lack of care. And on top of that, they're not paying their fair share. So more than ever, what this has highlighted is how important it is to make Revera public. It is owned by a federal agency. The federal government has the ability and the power to make this public. It needs to happen. Seniors deserve to be cared for. We know that there's overwhelming evidence that for-profit long-term care means more infections and more deaths, particularly in this COVID-19 crisis. So more than ever, we are redoubling our calls for Revera to be made public immediately. Donc, on exige le gouvernement libéral de rendre Revera public. Pourquoi? Premièrement, parce qu'on a vu les impacts des centres de soins de longue durée à but lucratif et comment ils ont les pires conditions pour nos aînés. Ils ont plus des infections et plus de décès. C'est clair. Au-delà de ça, on a appris par rapport à un rapport que Revera a des pratiques pour éviter de payer la juste part des taxes, des techniques agressives pour éviter leur responsabilité. Et c'est complètement en erreur. Il ne doit pas faire ça. Et ça, c'est pourquoi on exige encore le gouvernement libéral de rendre Revera public pour protéger nos aînés, et c'est essentiel de le faire. Donc, merci beaucoup. I would like to now move to invite Chris Aylward to present and provide some remarks. President of the PSAC, Chris Aylward, please.
Thank you, Jagmeet. Good morning, everyone. My name is Chris Aylward, and I'm the National President of the Public Service Alliance of Canada, the largest union representing federal public sector workers. I'm here today on behalf of more than 140,000 members who are covered by the Public Service Pension Plan. And I want to begin by thanking the Center for International Corporate Tax Accountability Research for their detailed analysis of Revera's international operations. Let me be very clear and very blunt. It is quite stunning and deeply disappointing to learn that Revera, which is 100% owned by the Public Sector Pension Investment Board, itself a federal crown corporation, is making use of offshore tax havens to avoid paying taxes around the world. PSAC members don't want their pension to profit off the suffering of our seniors, and we certainly don't want it associated with a corporation that is avoiding paying taxes that fund vital public services. Our union has long advocated for strong defined benefit pensions for our members and all workers in Canada. And we have always said that our members' pensions must be managed in the interest of our members and in a manner that is consistent with the public interest. The Public Service Pension Plan's sole ownership of Revera, the second largest network for for-profit long-term care homes in Canada, is just not consistent with the public interest. Revera is profiting from Canada's broken system of senior care, putting profits ahead of care, and especially during a pandemic, is nothing less than immoral. Thankfully, there is a simple and tangible first step the federal government can take right now to deal with Revera and make it clear that it does not support for-profit healthcare. It can facilitate the transfer of Revera to public hands so that it is owned and operated as a public, not-for-profit entity. A public long-term care operator will focus exclusively on providing quality care, and it will stop engaging in complex financial arrangements to avoid paying taxes. A Canadian Medical Association journal study of the pandemic's first wave found that residents of for-profit long-term care homes in Ontario with outbreaks were disproportionately more likely to die from COVID-19 than those living at a public municipal facility with outbreaks. Moreover, extensive research has long shown that residents experience worse outcomes in for-profit facilities than non-profit homes. And it is well documented that for-profit operators spend considerably less on residents than non-profit facilities and have lower staffing levels. A public model would not only ensure better care for seniors, it will also help ensure better wages and working conditions for thousands of nurses, personal support staff, and other attendants in long-term care homes who have gone above and beyond over the last 9 months. And let me conclude by saying in the early days of the pandemic, Spain and Ireland nationalized all private hospitals in order to better care for their citizens. Given the severity of the crisis in Canada, with over 13,000 out of the 17,000 pandemic deaths happening in long-term care homes. This is the kind of bold leadership Justin Trudeau's government should show today, a first step towards a national, publicly funded and accountable long-term care system. And our seniors deserve nothing less. Thank you.
Thank you so much, Chris. Really appreciate your words. We're going to go now to Candace Rennick, who is the Secretary Treasurer for QP Ontario. Please, Candace.
Thanks so much. Yeah, I'm the Secretary Treasurer. Our union represents 65,000 long-term care workers across the country. I started working in a long-term care facility when I was 16 years old. And since then, I really have watched the rapid deterioration of a system that's meant to provide dignity and respect to our loved ones in their final days. I know what it's like to work on the front lines of a long-term care facility, but I also have firsthand experience as a family member. My father died in a long-term care facility just a couple of years ago. The crisis in our nation's long-term care homes has existed long before any of us heard of COVID-19, but the pandemic has placed a huge spotlight on the crisis at the bedside. In Canada right now, seniors in long-term care homes are dying at a rate of higher than 1 an hour. And we know that the vast majority of these deaths, 3/4 of them in fact, are occurring in private for-profit long-term care homes. Why? Because for-profit corporations are placing a higher value on profits than they are on the lives of our loved ones. They are cutting whatever corners they can. They are staffing their facilities with up to 17% fewer staff than municipal or charitable homes. And countless studies have shown that for-profit homes deliver worse outcomes for residents on a host of measures. This motivation driven by greed at the expense of our loved ones must come to an end. This report peels back another ugly layer of how perverse and toxic the for-profit care industry really is. It shows the lengths that a for-profit care corporation will go to make profits. It's not enough that a multinational corporation like Revera is making enormous profits off the vulnerable and the elderly. But thanks to this report, we now know how far these companies are willing to go to avoid paying their fair share of taxes that in turn are supposed to support our healthcare system. Revera and other for-profit corporations are denying residents the care hours that they need. They are denying long-term care workers fair pay and the job security that they deserve. All the while, this multi-billion-dollar operation is using shell companies and tax havens to skirt their obligations. It is beyond offensive. Instead of putting the care of our loved ones in the hands of public health providers, governments are allowing it to remain in the hands of stock traders and international tax cheats. So I have to ask us, Who among us thinks that it's acceptable to treat our moms and our dads this way, our grandparents and our loved ones? Who among us can truly look our parents and our loved ones in the eye and say that they don't deserve better than this? And let's not fool ourselves. Revera is not the only for-profit provider that's operating this way. But the question now for the Trudeau government is, how much longer is it going to let these companies prey on our vulnerable seniors? Thousands of residents across Canada have died of COVID-19 in the past year, while companies like Revera have paid out hundreds of millions to shareholders, even as they collected tens of millions in government COVID relief supports. This report, coupled with the inhumane conditions that we have seen emerge during this pandemic, must be the final straw for the Trudeau government. The pattern is grotesque. The pattern is rampant. It is systemic. And simply put, as long as we treat long-term care as a commodity to be traded on the stock market, we will continue to see suffering and neglect. The only logical conclusion here is simple. We need political courage from the government. It is time to end for-profit care in Canada and truly start to value the lives of those living and working in our long-term care system. Thank you.
Thanks so much, Candace. Really appreciate your words. We'll go now to Christine Collins, who can share a really personal story about this for-profit care has done and what it means to her family. Christine, please.
Thank you. Well, my brother was transferred from the hospital on April 1st last year to Carlingview Manor, which is a for-profit long-term care owned by Revera, because they needed the bed. He was supposed to be in isolation on the secure floor for dementia residents. That didn't happen. There was no isolation, as dementia residents wander in and out of rooms, and it's a free-for-all with no monitoring. Less than 4 weeks later, he tested positive for COVID on April 25th with breathing problems, chest pains, and severe migraines that he suffers from to this day. My worst nightmare: no information, no communication, calls not returned, the stress, the worry, and the overwhelming guilt. Him so sick and not safe. He was finally declared COVID-free on May 19th. Between April 15th, when he was diagnosed, and May 19th, I made 35 calls that were not answered, but just bounced back to the main. I was able to leave 9 messages, but I got 0 callbacks. I got 1 call throughout that whole time from the doctor and no other updates. I got to speak to someone 7 times between April 1st and the end of May. I was told it was his responsibility to tell others to leave his room. They were very short-staffed. They had no one to monitor. I will say staff did their very best in a horrific situation, but things were very bad. There was lack of care for the residents, at least on the dementia floor. The shower room was closed during the whole lockdown. They had no one to sanitize between users, so it was closed. Carlingview Manor Revera saw 44% of its residents contact COVID, and it had the highest number of deaths during phase 1 in Ottawa, with 61 deaths. I completely blame Carlingview Manor for his getting COVID. No steps were taken then or now for social distancing, and there are still significant problems, specifically the shortage of staff, the part-time and the contract workers. What is needed is full-time workers with a living wage and benefits. I'm very upset and I'm angry that my pension that I paid into for 37 years and I'm now a recipient of owns Revera. There's guilt that my pension is funded on unethical practices and on the suffering of my brother and so many others like him. I would never have imagined ever that my pension funds contributed by public service workers would own a for-profit private care facility that cheaps out on care and puts profit before the safety and security of their residents. My pension plan should never be making a profit on the backs, and yes, the deaths, of those suffering in Revera homes. For months and months, I have said that it's well past the time to end privatization and to make Revera public. To now find out that Revera is making money through tax avoidance and offshore maneuvers is adding insult to my injury and only reinforces my resolve to see Revera made public. So I'm joining Jagmeet and the NDP, and I'm calling on you, Prime Minister Trudeau, to make Revera public now without any further delay. That's it. Thank you.
Thank you so much, Christine. Your words are very powerful and they mean a lot. Really, thank you for your advocacy and for your words. And what President Chris Aylward has said, and you as a recipient of the pension, Chris represents all the workers and said very clearly the voice of the workers that none of the workers want this. None of the workers want this. They want this to be made public. And Justin Trudeau has the power to do that. So thank you again, Chris, Candace, and Christine. Thank you so much for taking the time to be here. I know you've all got so many things that you could be doing, but I really appreciate the time. Thank you. And it's difficult to share your stories, and I appreciate that. We're ready now to take some questions. On est prêt maintenant pour vos questions. So I'll pass the MC role over to Nina, who will then oversee the questions. Thank you so much. Merci.
Merci beaucoup, Jagmeet. Alors, si vous avez une question, je vous inviterai d'utiliser la fonction « Lever la main » au bas de la page. If you have a question, please use the function raise hand at the bottom of the page, and then I will call on you to ask your question. So we will start with Christopher Reynolds with the Canadian Press. Please go ahead.
Thanks very much, Mr. Singh and Mr. Aylward, Ms. Rennick, Ms. Collins. That was very moving to hear and educational, so thank you. I actually have a question on an unrelated subject for you, Mr. Singh. I'm wondering if you prefer the format of the old cut and thrust of scrums, and also whether you have any concerns about whether the fact that MPs and ministers are now appearing almost entirely virtually means something is lost. Please go ahead.
I really appreciate the question. I just believe whatever is in the best interest of journalists getting as much access as possible and being able to ask the questions they need to ask. So really, I would turn it back on not just you, Chris, but all journalists, whatever is the most effective way so that people can ask the questions they need, so the media can get to the answers and can provide the coverage that they do an excellent job of providing. So I'm open with it. Scrum sometimes can be a bit hectic with lots of voices kind of yelling out for questions. So I don't mind the one at a time question asking, but again, I would put it back if journalists and media prefer another way to get more access and ask more questions, I would be open to it.
Thanks. And then another question related to fundraising. I'm wondering whether you've done any fundraisers yourself over the past few months or past half year, and also why I couldn't see any listed, if you have done those fundraisers, on the Elections Canada sites. Go ahead.
Certainly, we do something different. The ones that are listed on the sites are our ticketed events where folks purchase a ticket and attend. What I've been doing are fundraisers where we have a group of people on a Zoom call, and I've been actually making the pitch myself to encourage people to donate. And I'm happy to do that. I enjoy doing that. I love raising money for a cause that I believe in, and I believe New Democrats have been there to fight for people. We have been here, for example, today, we're fighting for seniors that don't get to have a voice. People like Christine's brother who don't have a platform. We are giving them a platform, and we are fighting for seniors across this country that are suffering in for-profit long-term care homes. So I'm proud that as a party, we are fighting for people who are voiceless often, and we are standing up for Canadians who want to see a public healthcare system provide the best quality care. And so I'm proud to raise funds for that.
Thank you very much. Next, I have David Thurkin with the CBC. Please go ahead.
Hi there. Thanks for taking our questions. Forgive me, I didn't get the name of the woman who lost, I believe it was your brother, in a Revera home. So I have a question for you.
Yeah, David, her name is Christine Collins, and her brother is still alive, just had contracted COVID and was sick and is going through a lot of hardship connecting with and getting information about her brother's health, and it's been going through a lot emotionally because of that. But yes, you can certainly, I believe Christine's okay to answer her question. Is that okay, Christine? Yeah.
Apologies, Ms. Collins. I guess the question that I have to ask is that, you know, any moment now we could be going into an election, and you know, a lot of times political parties they build their pitch to voters on, you know, providing, you know, plans and support for seniors. How do you think seniors like yourself are going to vote in the upcoming election, given that we're seeing this devastating situation in long-term care? You know, given that, you know, the situation that is, you know, how do you think people are going to, how much of a factor is this going to play in the next election, you think?
I'm going to try and answer. I know how I'm voting. I know that I will be asking a lot of questions of all the candidates. I will, if we're back to having meetings, I will be asking those questions. I know it's a concern to many, many, many seniors. We're watching our loved ones and what's happening to them now. But you can see by my hair what's going to happen to me. So it's for seniors, it's something that we're worried about, and care for our seniors is really important. There's no doubt where I'm voting, and there's no doubt where I'm going to encourage people to vote, because there's only one party that really thinks this is a very important issue. So that answers the question for me.
Okay. I'm going to switch gears here. So Mr. Singh, this question is for you. We're expecting, you know, an update, a technical update later today on vaccines. You have made issues with the lack of a plan from the government. So what do you need to hear from federal officials, ministers, to provide the assurance that we're back on track?
What we need to hear is not just a goal, and what the Liberal government has done a number of times is say we have a goal of 6 million vaccines by a certain date in March, or all Canadians by September. That is not a plan. That is simply stating a goal. To achieve that goal, we need to know, what does that mean in terms of daily doses, weekly doses? What does that mean in terms of monthly procurement and delivery of vaccines? It's not enough to just set a goal. We want to see the path and the roadmap to achieving that goal. And that's what's been lacking. Canadians have not seen a transparent, clear plan that there's a target of how many vaccines need to be procured, delivered, how many people need to get the vaccine in their arms for this to actually be achieved. That's what's been missing. And above all, we need to really focus in on vulnerable people. We know that seniors in long-term care are vulnerable. We know that people with compromised immune systems, we know that frontline workers are vulnerable. We want to see a plan that follows the expert advice of public health and safety experts and is laid out in terms of step-by-step how we're going to achieve it. That's what I'm looking for.
Merci beaucoup. Prochain sur la liste, Raymond Fillon avec TVA, c'est à vous.
Bonjour, Monsieur Singh, est-ce que vous m'entendez?
Oui, bonjour.
Bonjour. J'aimerais vous entendre au sujet du rapport sur Mme Payette qui a été rendu public hier soir. J'aimerais savoir, un, ce que vous en pensez, et deux, que doit être la réponse du gouvernement aujourd'hui?
Merci pour la question. Donc, premièrement, j'avais toujours des grandes inquiétudes parce que ce qui était présenté comme les conditions de travail, c'était horrible. Et maintenant, avec tous ces détails, on sait mieux que c'était vraiment horrible pour les travailleurs et travailleuses. Ça brise mon cœur de savoir que les travailleurs ont fait face des difficultés depuis des mois, des années, et c'est horrible ça. En plus, pour moi, ce qui est tellement inquiétant, c'est que le Premier ministre Justin Trudeau n'a pas fait le travail de savoir si Mme Payette était bonne pour la position. Parce qu'avec un peu de recherche, c'était facile de découvrir qu'elle avait les mêmes critiques dans les autres positions, dans les anciennes positions. Donc, ce que j'exige le gouvernement fédéral de faire, de Justin Trudeau de faire, premièrement, est-ce qu'il avait une entente avec Mme Payette? Parce que avec toute la preuve, toutes les conditions de travail, beaucoup de Canadiens et Canadiennes soulèvent la question pourquoi est-ce que Mme Payette mérite d'être effectivement félicitée avec une rémunération après elle a démissionné. Ce n'est pas d'accord, ce n'est pas correct. Les gens ce n'est pas d'accord avec cette décision. Donc, s'il y avait une entente, c'est quoi cette entente? Sinon, c'est une question de changer les lois. Je suis prêt de changer la loi pour s'assurer qu'on ne donne pas d'argent à quelqu'un qui est démissionné dans un contexte de conditions de travail assez horribles.
Ray, as-tu une question de suivi?
Oui, excusez, j'étais sur mute. Le gouvernement dit justement sur les indemnités de Mme Payette, elles sont prescrites par la loi. La loi, c'est la loi, on doit la respecter. Vous êtes vous-même avocat. Alors, est-ce que le rapport rendu public hier peut, selon vous, permettre au gouvernement de lui retirer sa pension?
Donc, avec les lois qui existent maintenant, il ne me semble pas qu'on peut faire quelque chose, mais on peut changer les lois. Et ça, c'est nécessaire de faire dans un contexte où quelqu'un a démissionné à cause des conditions de travail, à cause de maltraitement des employeurs, des travailleurs et travailleuses. Dans ce contexte, peut-être c'est nécessaire de changer les lois pour s'assurer qu'on n'ait pas une pension dans ce cas, parce que c'était assez horrible. Mais tout ça, c'est une question pour le Premier ministre parce qu'on doit savoir c'était quoi l'entente entre Justin Trudeau et Mme Payette pendant les discussions de cette démission.
Monsieur Singh, en anglais, s'il vous plaît.
So on this question, based on the law, the existing law, it doesn't look like there's a way to not continue to provide the pension and the travel benefits that flow from the position of Governor General. But given the conditions or given the context that horrible treatment of workers, the resignation, in this context, people are saying, well, why would we reward someone for this horrible treatment of workers? In this case, if it's a question of changing the laws to incorporate if someone is resigned because of mistreatment of workers, that there should be a way for us to not reward that type of behavior. I'm open to that change of law. But we need to know what Justin Trudeau agreed with. What was, if there was an agreement between him and Ms. Payette that resulted in the resignation. If there's an agreement, we need to know what it was, because if it's a limitation based on an agreement made with Ms. Payette, we need to know that. If not, if it's a matter of changing the law, we're open to that.
Thank you very much. Next, I have Alice Chen with the Hill Times. Please go ahead.
Hi, Mr. Singh, and hi, everyone else. Thanks for speaking on long-term care. I actually also have an unrelated question. It's directed at Mr. Singh. It's about there were security measures that were supposed to be implemented, mentioned in October. They mentioned like resident security and emergency panic alarms for MPs. So I guess my question was, what was the progress on those initiatives? Have they been implemented?
As far as I'm aware, they've not been fully implemented yet, but I'm sure that the security professionals could provide you with more updates. But as far as I know, they've not been installed as of yet.
Okay. And then in terms of what the initiatives are actually planning to do you think that there's sufficient security for MPs?
I think the idea in general of making sure MPs are safe is important in a democracy. People should be able to have a lively discourse. People should be able to raise concerns, but it should not result in threats that make MPs feel unsafe. And I think about some of the really horrible threats that some of my female colleagues have received, and how dangerous that is, and how that is discouraging for women to come forward in politics if there's a threat of violence. And some of the misogyny we've seen absolutely needs to be stamped down, and there needs to be safety and security for all workers, for all members of parliament, particularly those that have historically faced barriers or have been marginalized. I think that's very important.
Thank you very much. I just want to remind journalists, if you have a question, please use the raise hand function at the bottom of the page. Juste rappeler les journalistes, si jamais vous avez une question, d'utiliser la fonction lever la main au bas de la page. Next, I have Rachel Gilmore with Global News. Please go ahead.
Hey, so my first question is on the long-term care issue. Mr. Singh, I know that you regularly critique the government for using words and not action. And I wanted to ask you, if you were in Justin Trudeau's shoes, beyond the specific measure regarding Revera, what would you do to put an end to for-profit long-term care concretely?
Well, I think, first of all, to acknowledge, I really appreciate the question. First of all, Revera is not a small thing. It's the second largest provider of long-term care, for-profit long-term care in the country. So taking Revera and making it public would be a massive step forward. So I think we can't underline enough how important that step would be and how many lives would change with that one step, given how big Revera is and how major of a player it is. But what we said is a couple of things that need to be done. Right now, what for-profit companies are doing is that they are operating in a way where they are not paying their staffs well. They're not providing enough care in terms of hours of care. And as a result, they're cutting corners and making a profit. So one of the things that we've put out is that if we had national standards, what are the best practices of care? If those best practices of care, keep those standards, and we will see that these for-profit operators are only able to make these profits because they're cutting corners, because they're not providing the quality care. If they were forced to keep that care at the level it should be, they wouldn't be able to make those profits, and we could force them out of the market or ensure that they're replaced by nonprofit. They should not be operating in that way. The additional thing is, and what I think is very important, is tying funding to that quality of care. The same way we have a Canada Health Act that requires certain principles to be followed for funding to flow. Similarly, we could establish that for any company to receive, any organization to receive funding, they have to be meeting the standards, or they have to be meeting the quality of care, or at least the principles of the Canada Health Act. These are some concrete ways that we can immediately get to getting rid of profit in long-term care. And finally, simply stating that. We've not heard the Prime Minister ever come out and say clearly that for-profit care is a problem, that for-profit care is resulting in more infections and more deaths. That leadership would go a long way towards ending for-profit as well.
And for my follow-up, I'm going to totally shift gears here and do that classic journalist thing that I'm sure that you guys hate, of double-barreling a question. So I wanted to ask you about what we're seeing with respect to GameStop and the stock market. Obviously, a lot of people are characterizing it as this sort of stand between Wall Street hedge funds and individuals who like to trade stocks. And a lot of people are actually making a lot of money while draining it from the hedge funds. And within that context, you know, AOC has tweeted about this, and she said that she thinks that it's sort of hypocritical of Wall Street to be critiquing these individual traders. And I wanted to ask you, first and foremost, what your reaction is to this ongoing issue, whether you're supportive of these individual traders. And secondly, I wanted to know if you have any concerns about individuals who may be more vulnerable putting too much of their finances into this risky stock.
So in terms of stock advice, I should not be giving anyone any stock advice. I think you should consult a professional and make sure you get professional advice, be safe and be prudent, and make sure you make a good decision looking at all the evidence. So I will not be giving anyone stock advice. Certainly don't follow mine. But I can say a couple of things. First off, if we talk about regulation, the regulation should be clearly on the Wall Street bankers who effectively almost created did create a complete economic meltdown because of their greed, because in many cases their fraud, and there was no one held accountable for that effectively. I think there was only one person in the whole 2007, 2008 meltdown that was held criminally responsible. But in that case, there were thousands, if not millions of people that lost their homes, that lost their entire savings. Regulation should be placed on those who created the most harm. And some folks that are trading and day trading or doing different, engaged in different stock buying and selling, they are not the problem. The problem that we've seen historically has been a lack of regulation of folks on Wall Street who have taken advantage of workers in the whole subprime lending and sold products that were not backed up by any sort of real guarantees, and really crippled the entire world. And their greed put a lot of people in a horrible situation. That's where the pressure should be. And I absolutely agree with AOC when she said tax the rich. We absolutely believe that the wealthiest should be paying their fair share. That's what our focus has been on. Those who have made profits in this pandemic, those who don't pay taxes in Canada. I'm looking at Netflix, Amazon, and some of those who have made massive profits like Walmart and the large corporate grocery stores. We need to make the wealthiest pay their fair share. In this pandemic, who should pay? Should it be the workers that have lost so much, small businesses, or the wealthiest Canadians, the 44 wealthiest Canadians who increased their wealth by over $50 billion? That's who should be paying their fair share, and that's who should be regulated.
Thank you very much. Next, I have Cormac McSweeney with City News. Please go ahead.
Hi, this question is for, of course, NDP Leader Jagmeet Singh. I just wanted to follow up on the Governor General report now that it's officially out there. You are acknowledging today that, legally there's little recourse for the federal government to try and draw back benefits, the pension expenses that you had previously called for the government to pull back on. But I'm wondering, moving forward, since you say you're open to changing the law in the future, what threshold would there have to be for repealing such benefits? Because this is just a review, and in the mandate given to Quintet Consulting, they say flat out that they were not tasked with finding any guilt or making sure that what had actually happened was in fact. So right now it's just a review of a lot of allegations and a summary of those allegations. So if there's no finding of guilt, why would you want these benefits pulled back? I'm not defending anybody here. It's an awful situation, but there should be some threshold here.
Absolutely, but I think the threshold, looking at what happened here, there is a resignation, which is highly uncommon, a resignation, and in the context of the report didn't find guilt, but certainly said that there was a lot of people that had very similar complaints, and that their concerns were very, in terms of the details, there was similarity that could lead one to say that this is something that actually happened. And given how long and ongoing these concerns were, I think people are right to say, listen, at the end of the day, if the other Governor General is resigning in the midst of a context where there's a report saying that they were treating their staff horribly, and not just being a bad boss, but there was clear evidence or clear allegations raised of abuse, of harassment. These are not common things. These are not just someone who didn't do their job very well. This is about the safety and the well-being of workers. So it's come to a situation which is very severe. And in that context, the severity of what's happened to these workers, how long it's been going on for, and in the context of a resignation, I think this is an example of where people aren't feeling right about the fact that this is now Ms. Payette's going to receive a very significant benefit after the fact. And when we're talking about changing the law, it's for this one position, just the Governor General, just the remuneration of the Governor General. And in the context of a resignation and bad treatment of workers, should that be happening? I think it's a fair question. And I think if there's a question of changing the laws, let's be open to changing that. We can address what the threshold would be, lay out some clear criteria. But really, we want to know from Justin Trudeau, was there an agreement that led to the resignation? What did he say in that agreement? that would help us make the determination if we can change laws to address this type of thing in the future.
Cormac, do you have a follow-up?
Yeah, sorry, I didn't know I was muted in between those questions and answers. Yeah, so just do you think that in terms of those thresholds, there should be some sort of official finding of guilt or fact at least before benefits for any future governors general has their benefits scaled back? But also on a different topic, vaccines, the Prime Minister said in the House of Commons yesterday after you spoke that he has now received assurances from the European Commission, the president of the European Commission, that export permits there will not impact Canada's vaccine delivery. Is that satisfying to you to hear that we've gotten those assurances, or is that not enough for you to be satisfied that that we're going to be getting the shipments that we're due?
That is a good assurance, and I'm happy to hear that assurance. There was some concern about the lack of those export licenses being a barrier to receiving products produced in Europe, which is where the main manufacturing site is, and that would create problems for us to receive it. So that is encouraging news. But what I'm still asking for, and I think is very fair for Canadians to ask for, is a clear roadmap of how the federal Liberal government is planning to go from procuring enough vaccines. What does that mean in terms of procurement on a regular basis, monthly, weekly? What does that mean? And then what is a delivery timeline in terms of the rollout, the actual vaccination, to make sure people who are most vulnerable are getting the vaccine in their arms, are getting vaccinated. That still remains to be seen, and that's what I really want to see. And on the first question, I think this is absolutely something we can do, consult the experts, make sure we are putting in place a process that is fair, and that whatever the criteria is in terms of finding a fact or whatever the burden of proof is, we can make that assessment and make sure that there is a way in the future, or a way now, to make sure that this doesn't happen.
Thank you very much. Last question, we'll go to Tessie Sanchi with the Hill Times.
Hi, thank you everyone for sharing your perspectives. Mr. Singh, I'd like to get you to clarify a comment you made to Global News about long-term care homes and following national standards. A private home can follow national standards whenever they are developed, if they're developed, and still be private. I mean, should the onus be, regardless of whether they are public or private, in following national long-term care standards, or should they just be made public regardless?
Thank you for the question. I believe that there's no question about it. For-profit has no place in our healthcare system, period. I do not believe in profit in our healthcare system, and I certainly don't believe in profit in our long-term care. The question is, how do we get to the point where we remove profit from long-term care? And a couple of the steps that I outlined are ways to get there. But I think that we need to move immediately. We need to remove profit from long-term care. There's no question about it. Setting national standards is a way to help us learn from this experience. What were the best practices? What worked? What didn't work? And establishing those are guidelines that could help us deliver better care. And I think that's just something that makes sense anyways. We should always have a sense of gathering the best practices, what has worked, what are ways that we can deliver the best type of care for seniors. I think that is always something we should be doing, but I separate that from the fact that we absolutely need to get profit out of long-term care, and I'm open to looking at ways to do that, whatever those are, but I've outlined some of them.
Oh, all right, for my follow-up then, and I obviously appreciate the tragedies that have come out of long-term care. I mean, I think we need to be blunt about that. But realistically, you know, we do have a sizable for-profit system in this country. I mean, is it realistic to just assume that we can take every for-profit care home and make them into a public one?
It is realistic that we can shift to a completely public healthcare system. Absolutely. This is the same problem that we were faced with when we brought in Medicare. They were for-profit hospitals. We no longer have for-profit hospitals. We can do this. It's a matter of will. And there's a lot of ways. There could be a moratorium on new beds, that any new bed has to be public. There's lots of ways to achieve this goal. What we need to do is rally around the fact that there is overwhelming evidence. This is not a matter of it's a little bit worse. It is overwhelmingly worse for seniors, for their care when they are in for-profit. It is overwhelming. The evidence is not, I can't even imagine like the severity of the difference between when someone is in a for-profit care center and when someone is in a not-for-profit or public. The difference is massive. And the fact that we saw horrible conditions where, because of for-profit, the for-profit centers were trying to cut corners so much that when the military went in, they found that they were using old medication. They were reusing syringes. Like, these are deplorable practices. And this is what happens when a company is only trying to make profit. Seniors suffer. And when you think about the people, these are seniors who are so vulnerable, folks that have dementia, people that don't have a voice, people that are amongst the most vulnerable. For someone to prey off of them, to prey off the backs of someone so vulnerable, to make money off their backs, to pay dividends, like Seneca and Extendicare applied for public help, got help from the public, took money from the public, and then turned around and paid out dividends to their shareholders while there was a tragedy going on, while people were dying in their long-term care homes. That, to me, is not something we can just negotiate around. The reality is for-profit kills people. It kills seniors. It makes their conditions worse. It makes them more likely to get infected, more likely to die. Because of that, it has no place in our healthcare system. And I'm going to fight to make sure that's the case. It's not going to be easy, but it is definitely important.
Thank you very much. Merci beaucoup. Ceci conclut notre conférence de presse. This concludes our press conference. Thank you, everybody.
Thank you so much. Thank you, Chris. Thank you, Candace. Thank you, Christine. Really appreciate it.